Now with the skull, there's going to be some holes to know and some other little structures I forgot in that other video. But on the posterior aspect, well, the occipital bone is already posterior, but there's a bump. And you can kind of feel it on the back of your head. There's a bump back there, and that's called the inion, I-N-I-O-N, or external occipital protuberance. That's a little bump right there. Also on the inferior aspect of the occipital bone are occipital condyles. This is what meets up with your first vertebra, one on each side. And then holes, we have the foramen magnum. Okay. And I always think of Dirty Harry. Well, maybe too young for Dirty Harry, but he had a magnum and he was shot a 44 magnum. He was shot out of a big hole. Dirty Harry, it was Clint Eastwood. It wasn't some old guy down the street. And then we have here, that hole right there is the foramen ovale, and what runs through that is the maxillary division, the mandibular division of cranial nerve 5, trigeminal. So just know that that's the mandibular division, or V3, and just posterior and a little bit lateral to that is the foramen spinosum. And if you want to think of a spot, spinosum, SP, foramen spinosum. And what runs through there is the middle meningeal artery. And then a little bit more posterior, we have the carotid canal, and then the jugular foramen. Okay. Now, there's one other hole you have to know, but you can't see it from this view. It's only internal. So I'm going to grab this one here, and well, let's go over the holes again. Back here is the jugular foramen. Okay. This would be the carotid canal. Here's the foramen ovale. There's the foramen spinosum. And right here is the foramen rotundum. I don't know if you can see that or not, but right there, foramen rotundum. And what runs through that is the mandibular division of the trigeminal nerve, or cranial nerve 5, with its trigeminal, so V Roman numeral for 5, and has the the maxillary division, V2, because there's 3 segments of the, well, that's a bad word to say, or it's not the right word, 3 divisions of the trigeminal nerve for sensory in the face. And the second one is the maxillary division. All right, the first one is ophthalmic, but won't be doing that. Right here, we're going to call this that Turkish saddle. It's called the sella turcica, two words, S-E-L-L-A, and turcica is T-U-R-C-I-C-A. Sella turcica, that's where the pituitary gland sits. Now, also in the skull, we have these holes above, well, this one right here you can see is a notch. So it's above the orbit, so supra-orbit, so supraorbital notch. Down here, it's a hole, so it's a foramen, and call that the infraorbital foramen. If this were not notched out in a hole, it would be a supraorbital foramen. Okay? Now, you can see the teeth, and the teeth, all you have to know for the lab anyways, is that these are called alveolar processes, A-L-V-E-O-L-A-R, processes. But since this is the maxilla, this is the alveolar processes of the maxilla. Now, let's go to the mandible, which is the jawbone. And then since this is the mandible, these are the alveolar processes of the mandible, the teeth sockets. Actually, also on the mandible, we have the mandibular condyle, this big thing here. That's what forms the mandibular part of the TMJ. Do you have TMJ? Yes. Everybody has a TMJ, temporomandibular joint. It's a syndrome that not everybody has, but this is the condyle that fits into that joint. So mandibular condyle. This is called the coronoid process of the mandible. Right here, that little structure. And then that foramen on each side of the mandible, kind of below on the chin, those are called the mental foramen. And if you think about it, okay, if you were to do this, you're deep in thought, okay, so mental foramen would be right here. And let me take a look one more time in here, make sure I didn't miss anything. A couple other little structures. All right, if you can see these little holes, that's part of the ethmoid bone, which you know, your sense of smell, those nerves here, we'll learn that in the next test, olfactory nerves, but they sit there right on top of that, which is called the cribriform plate. And in between the cribriform plate, that little dividing thing is called the crista galli. Okay? And actually, what attaches to that, in the other video we talked about the falx cerebri, that comes over and attaches to that crista galli. That anchors it. Make sure I didn't miss anything.